Everyone, so welcome to module 8, and we will discuss today about the control of impurities and the SEP approach. I am Gaël Roncin, so I'm an assessor and part of the new dossier team in the certification of substance department in EDQM. And I'm here with my colleague Chloe.
So good morning, everybody. So my name is Chloe Boom, and I am working in the revision team of the certification department. So today we will see that there are several types of impurities which may be found in your active substance. And the two questions which will guide us today is what is the impact of a certain impurity in the impurity profile of your active substance, and how to accordingly set the specification. So just as a reminder, excipients are out of scope of this presentation. So active substances are under the directive 2001/83/EC. Which sets the standard EU legal framework for human medicines. As for veterinary products, there is another regulation that applies, as you can see. So which are the key guidance on which we rely? The most important ones is from the ICH Q6A, which provides guidance on how to set specifications. And there are also two documents from the EDQM. So one for the content of the dossier for chemical purity and microbiology, and another document which is more recent since last year, which sets the requirements for the content of a CP dossier according to CP 2.0. Then, excuse me. Then we will see throughout the presentation that there will be several other specific documents which have to be applied and which provide guidance on each type of impurities. And I would also like to highlight that both ICH, the Q2 revision 2, as well as some general chapter from European Pharmacopoeia, do provide guidance on analytical procedures that should be used. So what are our expectations? So we would like the impurity profile of the material that you are manufacturing to be known in details, which means that we expect analytical specification to be put in place, which should control the impurity profile and be representative of the process that you adopt. And we do expect to see this in a discussion which shows understanding of the impurity profile. So information regarding the origin, the fate, and the carryover impurities, which should be the basis to set your specification. And I will now let the floor to my colleague Gaël.
So here, during this presentation, we have decided to use a fictive case, which is the manufacturing process of venlafaxine hydrochloride that is represented in the scheme. It's a 4-step processes starting from 2 starting materials and where there are 3 different intermediates, and we will see further down in the presentation with a color code that you will have to remind for all the impurities, starting material, intermediates that are discussed further downstream in the process. So next slide. So we will start to discuss what is related substances. So the key guidance is ICHQ3A, and this is complemented by the General Monograph 2034 related to substance for pharmaceutical use, where the reporting, identification, and qualification thresholds are linked to the maximum daily dose of the API that you are considering. So in that case, it's below 2 grams per day. So we will use the one that is highlighted in orange on the side of the slide. The general chapter 5.10 on the control of impurities in substance for pharmaceutical use, and also, of course, the individual monograph for the substance. Next slide. So to set a good control strategy, you have to have understand the risk for the quality of the API, to set acceptance criteria for impurities to be justified based on their fate and carryover up to the final substance, meaning that you have understood the ability of your process to purge the impurities that are present in the process. You have to limit major and recurrent impurities as specified impurities, and to understand the risks of having uncontrolled impurities up to the API to ensure compliance with the monograph. And for that, a special attention should be given to the intermediates that are late in the process, including the crude API, and related substances controlled upstream by analytical methods that are different from the one at release, and also the API-like impurities that are usually close running to the main peak. Next slide. So while applying for the certification for suitability of the European monograph, you have to use a terminology that is referring to or is traceable to it. You have to cross-check the transparency list of the monograph to see if all the impurities are possible in your manufacturing process. And if you have in-house impurity present or limited above the disregard limit, suitability of the monograph has to be demonstrated, and set the control in the specification for those impurities has to be implemented. And chemical structure and possibly chemical names have to be given also. Next slide, please. So let's see the transparency list of the monograph. So for the venlafaxine hydrochloride, there is only one specified impurity, which is impurity F, which is limited to not more than 0.1%. And next, so all the other detectable impurities are detectable as unspecified impurity and are controlled at not more than 0.10. Other detectable impurities may not be present in all processes. They are listed as detectable by the monograph method. Next slide. In the case of venlafaxine, for example, the impurity B and impurity H that are highlighted in red and orange are not possible or unlikely to be present with the route of synthesis used, while, for example, intermediate B is impurity C of the monograph. So, next slide. So going back to the manufacturing process of venlafaxine, there are two identified starting material, and as a manufacturer of API, you have to have an understanding also of the impurity profile of the starting material. Next slide, please. So for example, for starting material 1, it starts from paramethoxybenzyl alcohol that is reacting with thionyl chloride to give the chloride derivative, and substitution with sodium cyanide gives the nitrile derivative. So you have to set specification for that. You can check. Chloe, please. Thionyl chloride is a reactive reagent hydrolyzed during the workup. So, and we will discuss it in the mutagenic impurities. It has been found detected in the batches. Precursor 1 is found at 0.21% in the starting material 1. But you have seen that it's further eliminated in the intermediate A, mainly due to the crystallization of this intermediate. So control to a higher limit is acceptable. The paramethoxybenzyl chloride, it's presenting an alerting structure, so it will be discussed as a mutagenic impurity. And for this, even if it's found as a trace in the starting material 1, setting specification at not more than 0.15 has been chosen, and we will see later on why. For impurity RT 0.92, it's likely a byproduct, It's found in the batch at 0.25% and not detected after in intermediate A. But there is a fate impurity at RRT 1.15% that we'll see in intermediate A at 0.21%. So setting control at 0.40% is acceptable, and the proposed specification for the starting material 1 is set below. So while considering fate, you have to think of also potential byproduct side reaction also. Let's move to the starting material 2, which is prepared from cyclohexane by first oxidation, then dehydrogenation, and you can set the specification accordingly. So cyclohexane is found at 0.11% in the batch data, but it's eliminated during the filtration in intermediate A. Also, it's a volatile product that will be eliminated during the drying. So setting a higher limit for this impurity is acceptable. So for cyclohexanol, it's the same. We have batch data that it's present at 0.13%. It's eliminated during filtration, but to a lower extent. It's found below 0.05% in intermediate A and tested not detected in intermediate B. Setting a limit to 0.20 is acceptable. Another impurity is present at low level. It can be controlled under unspecified impurity, which lead to the specification below proposed. And let's move now to intermediates. So there are 3 intermediates, and they will be described in section 3.2s-4. So starting material 1 is present in intermediate A at 0.90%. It is found absent in the next intermediate and not detected in API. So setting a control at 0.3% is acceptable. And for the impurity RRT 1.15, it's generated from the impurity at RRT 0.92 that we have seen earlier. And it has a fate impurity in intermediate B at 0.15%. So a control at 0.25% is acceptable also. Starting material 2, it's present in this intermediate A at 0.53%. It is eliminated in the next intermediate B and not detected in API. A control at 1% is considered acceptable, which will lead to the specification below. For intermediate B, the same can be performed. So starting material 1 is present at very low level, so it will be controlled as unspecified impurity. Intermediate A can be, it's the unreacted and intermediate carried over. It's eliminated during the crystallization in the next intermediate C. When spiked at 2% in intermediate B, it is found not detected in intermediate C, and no fate impurities is found. So a control at not more than 2% can be acceptable based on the spike purge studies performed. The dehydrated impurity is formed from dehydration of the intermediate B, and it's found undetected in intermediate C, and its fate impurity is an impurity from the transparency list of the monograph. So control at 0.80% in intermediate B can be acceptable. As for the next impurity, which is the reduced impurity from the one above, it's found at 0.06%, so it can be controlled as an unspecified impurity. Please note that this impurity also is giving an impurity from the transparency list of the monograph. And the impurity RRT 1.20, it's originating from the previous intermediate, and setting a control at 0.20 is acceptable, which will lead to the specification below. The last intermediate is intermediate C. This one, you found 3 impurities that are found from the transparency list of the monograph. They the first one is impurity F. It's removed during crystallization stage. It's present at 0.38%, and this one can be controlled at up to not more than 0.50% in intermediate C, and it will be controlled in the API at not more than 0.1%. The intermediate B, which is also the impurity C of the monograph, is a process impurity removed during crystallization and found below 0.05% in API, even if it's present as 0.27% in intermediate C. Setting a limit at 0.40% is acceptable, and it will be controlled in the API as an unspecified impurity. The same for impurity D, which can be controlled as an unspecified impurity. And for impurity RT 1.10, which is generated from previous step, it is found below 0.05% in the API, and a control as specified impurity at not more than 0.15% in intermediate C is acceptable. This is assuming, of course, that you are using the same method for the monograph to control the intermediate C and the API. So setting the specification can be set like proposed here, and it is expected that a special attention should be paid to the impact of the impurity generated or carried over from the latest intermediate to the API. And this is very important. Next slide, please. So you can prepare an overview of your control strategy with which can be presented in a table like the one proposed here, where you put the impurities on the side, where they are what are the limits, in the various intermediate or starting material proposed, and an overview of the origin, fate, and carryover for each impurity, and the limit and control strategy proposed. And this can be included in the quality overall summary. Next slide, please. So in our case study, turning back to this, so for the related substances, now we have a nice case. We have related substances that are controlled by the transparency list of the monograph, and there are no in-house impurity present above the 0.05% threshold in the API. So the specification can be set as the one from the monograph. So impurity F, unspecified impurity, and total impurities in line with the monograph. Next slide. So, but real life can be different, and sometimes you have in-house impurities that are present. What is happening if you are using an in-house analytical procedure, and how to handle the situation, and which impurity to include in the specification. For this, we will use the flow diagram that is presented here, and you have to ensure suitability of the monograph to control the impurity profile of the final substance. And I will use also the general monograph 2034 for setting the limit for reporting, identification, and qualification threshold according to the maximum daily dose of the API considered. A special case will be discussed for STEP 2.0 later on. Let's see now what is the suitability or unsuitability of the analytical procedure of the monograph to control all the related substances present limited above the disregard limit. And this should be demonstrated by the method of the monograph or by an alternative analytical procedure when the pharmaceutical procedure from the monograph is suitable to control the in-house impurity, but you have an in-house procedure that can be used. You have to show in that case equivalent results comparing the two methods cross-validation data on the same batches should be provided using some spiking solution if necessary. If you are using too pure material, you have to provide those spiking studies. You can use also additional analytical procedure when the analytical procedure of the monograph is not suitable to control your in-house impurity and should supplement the monograph procedure. Unless absence of the corresponding impurities is demonstrated, this will be reported on the SEP. In both cases, the validation in line with ICH Q2R2 has to be provided in section 32S42. For 3, sorry, for 3. Let's go back to our case study, to venlafaxine. Here we have 3 in-house impurities that have been found in the final API. Impurity 1 is present at 0.01 to 0.02%. So following our diagram, you can see that the impurity is always found below the reporting thresholds, so it can be considered absent. Let's move. It's for in-house impurity 2, it's found between 0.04 and 0.06%. So it can be controlled as an unspecified impurity. So we do not need to report it in as a controlled impurity. For in-house impurity 3, it's present at 0.08 to 0.12% in the API. So following the diagram, the impurity has to be limited in line with General Monograph 2034. And for this, we can set a limit at not more than 0.15% in line with the General Monograph 2034. If the impurity would have been higher at than 0.15%, you will have to demonstrate biological safety of the impurity at its level in the API. So the specification will look like the one proposed here, with including the impurity 3 with RRT 1.10 at not more than 0.15%. Special case for SEP 2.0, you have to remember that the specification for the final substance in section 32S41 should make reference to the analytical procedure of the monograph, which is reported on the side of the slide. Next slide, please. So in another case study where you are using this time an in-house developed analytical method that has been suitably validated. So what is happening for the 2 impurities that we have found in the API? It's in-house impurity 4 that is found at 0.01% and between 0.01 and 0.03%. So this one is always found below the reporting threshold. So it can be considered absent. So no need to report it in the specification. Unless you wanted to report this impurity. So if you want to report it anyway, you have to show suitability of the monograph to be demonstrated. And then if not suitable, in-house method will be appended to the SEP. Let's imagine that it's not the case and you do not want to report it. So for impurity, in-house impurity 5, RT 1.10, it's found between 0.05 and 0.11% in using your in-house analytical method. So it has to be limited in line with General Monograph 2034, and the in-house method will be appended to the SEP. So with a limit of not more than 0.15 that can be implemented. Let's see how the specification will look like. So specification will report the one from the monograph, so impurity F, unspecified impurity and total impurities, and your in-house impurity 5 at not more than 0.15 with the method described as in-house. So in section 3.2s4.1, you should make reference to the type of analytical procedure that has been used. So either the European pharmacopoeia method or the in-house method. The in-house analytical procedure for impurity 5 is additional to the one of the monograph and will be appended to the SEP. Next slide, please. So, for example, you have managed to identify what is the impurity at RT 1.10. It's not presenting an analytic structure. It is related to the API and can be traced up to the starting material 1. And you can set, for example, limit in the starting material to control also this impurity. But let's see what is happening to mutagenic impurity with Chloe. Thanks.
So we will now see how to control mutagenic impurities in your API. So the reference guideline we rely on is ICHM 7 revision 2. So to this guideline, there are two other related documents, so namely an addendum, which has been published along with the second revision, which provides specific data for non-mutagen, as we will see in a few minutes. And there is also a question and answer document, which provides some clarity on certain aspects of the guideline. So this guideline, ICHM 7, applies only to human products, as for veterinary ones, there is another EMA guideline which is to be applied. However, today the presentation will focus only on ICHM 7 for human products. And just as a reminder, the definition of mutagenic means inducing or being capable of inducing genetic mutation, whereas carcinogenic risk refers to the potential of causing cancer. So how to control mutagenic impurities in your active substance? So we can say that there are three main steps to be followed. So the first one is the active substance assessment, the second one is the hazard assessment of those impurities and their classification as per ICHM 7. And then, where relevant, the last part is to set acceptable limits and to propose a control strategy, as we will see. So the first step is the active substance assessment, which should include all actual and potential impurities, which will then have to be assessed for their mutagenic potential. So to give some clarity, actual impurities refer to those which are identified with known structures and those which are actually found at the end of your process in your final substance above ICH Q3A reporting thresholds. Then you have all other potential impurities, which are those likely to be present in your final substance. So these refer to all kinds of other impurities, such as starting material, reagents, byproducts, and so on and so forth. So once you've identified all the potential impurities that may arise from your manufacturing process, then you should perform hazard assessment in order to classify all those impurities in line with ICH M7. So the guideline foresees 5 different classes, as we will see, and as you can see on the slide. And the guideline states that there is an expectation that the presence of a structural alert and its assessment will be conducted using quantitative structure activity relationships predictions. So this means that in silico assessment is expected to be performed using those QSARS predictions, which would predict the outcome of a bacterial mutagenicity assay. So this in silico assessment is expected to be performed using 2 complementary methodologies. So one which is expert rule-based and the other one which is based on statistics. So just a few details about the classes. So following the in silico assessment, you may be able to classify your impurity as class 1, which refer to those which are known mutagenic carcinogen. So we will see in a few minutes that for this class, there is a specific permitted daily exposures that can be applied to define the limits. Then classes 2 refers to non-mutagens, but with unknown carcinogenic potentials. So in this case, there is no permitted daily exposure available for those compounds. And we will see that another approach to define the limit has to be applied. So it's the toxicological threshold concern, which is more conservative. And then we will have the class 3, which refers to the chemicals with unstudied mutagenicity. And then the two other classes, classes 4 and 5, are to be treated as not mutagenic. So it refers to those which have an alerting structure, which would be, for example, shared with the drug substance in the same position, or only the presence of no structural alert, or an alerting structure, which would be demonstrated that there is no risk with regards to mutagenicity or carcinogenicity. Then the next step is to set acceptable limits and to propose a control strategy. And this will be expected to be performed for class 1, class 2, and class 3 impurities. So the acceptable limit will be defined by dividing the permitted daily exposure divided on the maximum daily dose for your substance. So as I've said, there are two approaches. So either you are able to define a limit which is specific to your compound. So this will be applied for class 1 impurities. And in this case, the limit will be defined according to the specific acceptable intake, which is reported in ICH M7 addendum. In case of class 2 or class 3, so there is no specific acceptable intake available. So in this case, you will follow the TTC approach, defining the TTC limit, which will be defined according to the duration of the treatment. So as you can see in this slide, the acceptable intake of 1.5 micrograms per day is considered to be protective for lifetime daily exposure. And I'm taking the opportunity here to remind you that the maximum daily dose and information regarding the use of the substance is to be included in section 3.2 S13, along with the route of administration and the treatment duration, which are considered for the development of your control strategy and where relevant specification. So once the acceptable limit has been defined for each class 1, class 2, and class 3 impurities, then a control strategy should be proposed. So there are 4 different options prescribed by ICH M7. So there is option 1, which refers to a control which is set at or below the acceptable limit in the final substance. So in this case, this would be transparent on the CP because it will be either included in the specification which are now appended for CP 2.0 or will be directly reported on the CP for all types or hybrid CPs. Then you have option 2, which refers to a control which is set at or below the acceptable limits, but elsewhere in a relevant material, such as starting material, intermediate, and so on and so forth. You have the option 3, which refers to a control which is set above the acceptable limits in a relevant material. Or you have option 4, which refers to the absence of control, which is based on process understanding. So a little bit more details about those options. So for example, option 1 would be expected for impurities which are introduced or formed in the last synthetic step of your process, unless otherwise justified. So in this case, you may refer to the question and answer document. For option 3, as you're proposing a limit which is above what is acceptable, you need to justify the suitability of the limit that you're proposing. And this should be performed by demonstrating that the levels of the impurity will be found below 30% of its acceptable limit in the final substance. And this is a very important point. And this option, to apply this option, usually spike and purge studies are highly encouraged. And then finally, you have option 4. So it is based on the understanding of your process and its effect on the purge of impurities, so that you are ensured that at the end, the impurity will not be present above its limit in the final substance. So this option can be supported by calculated purge factors and also if relevant batch data, for example, if the impurity is introduced or formed late in the process. So this option will be, for example, suitable for impurities which are inherently unstable or those which are introduced very early in the process. Other aspects of the guideline which have to be considered. So the TTC limit has to be applied to individual impurities. However, if you have 3 or more class 2 or class 3 impurities which are controlled in your substance, which means as per option 1, then there is a need for you also to implement a limit for total mutagenic impurities in addition to those individual limits. So for this, defining the limit for total mutagenic impurities, you can find guidance in the table 3 of the guideline. Then for all carryover studies or any analytical results that you provide, we do expect you to provide as well suitable and relevant validation data of the analytical procedure that you're using, and this in line with ICH Q2 revision 2. And then regarding periodic verification testing, which means when you test on pre-selected batches or at a certain frequency instead of testing each batch, this is to be applied only when option 1 control is in place. It's not appropriate for options 2 and 3 where you control the impurity upstream in the process. And this should be, of course, justified as foreseen in the guideline. So coming back to our example for venlafaxine hydrochloride, so we will consider that the active substance assessment for all actual and potential impurities has been already performed. So we will go directly to step 4, which is the hazard assessment to classify those impurities as per ICHM 7. So we will consider that the outcome of our hazard assessment has shown a risk for the following impurities. So for example, we do have here formaldehyde, which is a known mutagen. We do have here potential byproducts which may be formed, which are the corresponding sulfonate esters. Coming to the starting material, we do have here thionyl chloride, which is being used, which is a known mutagen. And as Gareth said before, the precursor of the starting material, which shows an alkyl structure and alkyl chloride. Coming to formaldehyde. So it is a known mutagenic carcinogen, which is reported in ICHM 7 addendum. So it is actually classified as class 1. However, it is not considered to be mutagenic when taken orally, which is here the case for venlafaxine hydrochloride. And this, because its permitted daily exposure is so high that it will lead to an acceptable limit, which is way above ICH Q3A thresholds. So in this particular case, formaldehyde will be treated as not mutagenic. Then coming to the potential byproducts from step 2, so the mesylates, these are known mutagen but with unknown carcinogenic potential. There is in vitro mutagenicity data available in the literature, so we can classify them as class 2. And coming to the precursor, which shows an alerting structure, so we will consider today that there is no database or literature data regarding its mutagenicity, so we will consider this impurity as class 3. And thionyl chloride is a known mutagen. It's also classified as class 1. So now how to set acceptable limits and to propose control strategy. So as we've seen, paraformaldehyde will be treated as not mutagenic. Coming to thionyl chloride, we can directly propose an option 4 because it is used very early in the process, so pre-starting material. It is highly reactive in water, which is widely used ahead. So we do consider that option 4 is justified, and this will be the minimum justification that we would be expecting. So then we will see more in details about the 2 other examples. So again, the acceptable limit is here and information regarding the substance. So the maximum daily dose is 424.5 milligrams per day. It is given orally for a treatment duration of over 10 years to lifetime. So for the 2 sulfonate esters, so we've classified them as class 2. So the TTC limit does apply for each of those impurities, which is 3.53 ppm when considering the acceptable intake of 1.5 micrograms per day, because venlafaxine hydrochloride can be used for more than 10 years. So the proposed control is in venlafaxine base, so stage 3 of the process, and the limit of not more than 100 ppm is proposed for each impurity. So this refers to ICH M7 option 3 that we will justify with spike and purge studies. So for example, the justification that we could consider would be that spiking of venlafaxine base was performed with 200 ppm of each impurities. So in this case, 200 ppm is relevant because it is above the limit which is being proposed. And the results have shown that both impurities were not detected, so below limits of quantification 1 ppm, which is below 353 ppm in the final substance. And this justification has been supplemented by carryover data to the final substance, which have also shown that both impurities were not detected. So in this case, it is demonstrated that each impurity is found below 30% of the TTC limits. So in this case, we consider that the option 3, is well justified. So coming to the second example, so which has been classified as class 3, so the precursor of the starting material. So again, the TTC limit applies, and the proposed control is set at not more than 50% in the starting material. So again, this refers to ICH M7 option 3. And the justification, again based on spike and spurge studies, would be that spiking of the starting material with 0.5% of the precursor was performed. So again, here the concentration of the spiking is higher than the limit which is being proposed. And the results have shown that the impurity was not detected, so below LOQ 0.9 ppm, which is again below 30% of the TTC limit, in venlafaxine base by LCMS. And this has again been supplemented by carryover data to venlafaxine base, which have shown that the impurity was not detected. So in this case, the justification was based on venlafaxine base and not directly in the final substance, but which is acceptable because it is relevant and it is foreseen also by the guideline. So again, in this case, it has been demonstrated that the impurity is found below 30% of the TTC limit. So the option 3 is well justified. So this is the exercise that we would be expecting to see in your dossier, and the control strategy and the outcome of the discussion, so including the classification of each impurity as well as the control which is being proposed, so for class 1, 2, and 3 impurities, has to be summarized in impurity sections, so section 3.2s.3.2 under mutagenic impurities. So now coming to nitrosamine impurities. So ICH M7 has identified certain structural groups which are of high potency risk, even when considering the TTC approach, which is normally considered as conservative. So the nitrosamine impurities are part of this cohort of concern, which is identified to be a significant carcinogenic risk. So for those impurities, there will be a specific guidance, even more conservative than the TTC approach. So you will have, for example, the general chapter 2.5.42 from European Pharmacopoeia, which will provide guidance on analytical procedures. Then we have the EMA assessment report on nitrosamine impurities in human medicinal products. So this report only provides general guidance. The most important document that is to be considered for to consider the risk for nitrosamine impurities would be its corresponding question and answer documents, which has 3 different appendixes. So Appendix 1 provides specific data on acceptable intakes which are established for nitrosamine. Appendix 2 explains the general approach, the carcinogenic potency categorization approach, which will have to be followed if the impurity is not reported in Appendix 1. And then there is Appendix 3, which provide guidance on how to conduct a bacterial mutagenicity assay test. And this is today out of scope of this presentation. So the risk assessment that we would like to see in CP dossier should follow EMA principles, which means, so step 1 is to perform a comprehensive risk assessment. And this should be done by considering all potential sources of contamination or formation of a nitrosamine impurity. So for instance, if your process foresees the intentional use of a nitrosating agent, along with the presence of secondary or tertiary amines under favorable conditions. I would also like to highlight that special attention should be paid for the potential formation of nitrosated API. So for example, if your API contains a secondary amine and favorable condition, or if a risk for your substance is known, which means that it is reported in the Appendix 1 of the question and answer. However, this would be really case by case because it's very specific to your process and conditions. So then if you identify the risk in this first step, you should perform confirmatory testing in order to confirm or refute the presence of nitrosamines. So please note that the omission of a control can be justified only if the levels are found below 10% of the acceptable limit. And this testing should be performed using suitably validated procedures with a relevant limit of quantification. And again, here the description and full validation data should be provided. And so I also would like to highlight that the analytical procedure really should be sufficiently sensitive, which means that the limit of quantification should be at or below 10% of the limit in order for us to consider the omission of a control to be justified. So then, if the presence of your nitrosamine is confirmed, which means if it is present above 10% of its limit, then you should propose a control strategy. In this case, we do expect a control at the acceptable limit to be implemented in the specification of the final substance. We also do expect further root cause analysis to be performed and also where relevant to implement some corrective actions throughout your manufacturing process. Then how to define an acceptable limit for a nitrosamine impurity. So again, the principle is the same. It's the acceptable intake divided by the maximum daily dose. And for this, you will have to use Appendix 1 and Appendix 2 of the question and answer documents. So as I've said, Appendix 1, you can find specific acceptable intakes for a certain nitrosamine, which can be directly used for calculation. Then if it is not reported in Appendix 1, then you should follow the CPCA approach, which is described in Appendix 2, which will allow you then to know which is the acceptable intake to be used for the limit calculation, depending on the chemical structure of the impurity. The key point to remember is that the EDQM relies on the question and answer from EMA for the assessment of the risk for nitrosamine impurities. However, you should pay attention because this document or its corresponding appendixes frequently get revised. So, for example, you may have specific acceptable intakes for nitrosamines, which can be updated following, for example, further toxicological assessment, which is performed. Or you also have often additional nitrosamine impurities, which are included in Appendix 1. So we do expect CEP holders to perform the risk assessment for nitrosamine impurities and, if relevant, propose a control according to the most recent EU requirements. So please ensure that you are referring to the latest version of the document. And again, the risk assessment is to be included in your dossier in section 32S32 under nitrosamine impurities. And I will now give the floor to Gaël for residual solvents.
Thank you, Chloe. So let's move on to another type of impurities, residual solvents. So on the next slide, you can see that the guideline is ICH Q3C and the general chapter 5.4 for classification and recommended limits for the solvents. Also, the document CPMP, KWP for 5003 revision 1 and X1 has to be considered. For class 1 solvents, they are usually now used as, they are present as contaminant in other solvents such as benzene, that is a potential contaminant of acetone, toluene, or methanol. A control is needed in the API unless you have a limit in the originator solvent, ensuring that the class 1 solvent in the API is below 30% of the ICH limit based on a rationale, or yes, that you have demonstrated that this class 1 solvent is below 30% of the ICH limit in an intermediate or in the API by a validated method on 3 consecutive batches or 6 pilot batches. For class 2 solvents, that are solvents that has to be limited, a control is needed in the API if it's used in the last step or if it's found above 10% of the ICH limit. Then you have to implement the control in line with the ICH limit using a validated method. If it's found below 10% of the ICH limit and not used in the last step, no testing in the API is required. Next slide. For non-classified ICH Q3C solvents, toxicological justification for any proposed limit has to be provided. So for the class 3 solvents, which are solvent with low toxicity, there is a special case for the SEP procedure, because in the content of the dossier, you can find that those solvents can be limited by a test for loss on drying with a limit of not more than 0.5% when appropriate. If the limit of the loss on drying test in the monograph is higher, then a specific test for residual solvent should be introduced. Which can be depicted in the diagram on the side. So if it's used in the last step and there is a test for loss on drying, then you have to check if the test of loss on drying is above or below, not more than 0.5%. If it's above 0.5%, sorry, the control in the API with a validated method at ICH limit is required. Otherwise, you can use a test for loss on drying. And if there is no test for loss on drying in the monograph, then a control in the API with a validated method has to be implemented. The same if the solvent is not used in the last step, but it's found above 10% of the ICH limit. The same that we have seen can be implemented. And if it's below 10% of the ICH limit, then there is no control that is required for this solvent. Let's see how. But for DMSO, which is a high boiling point solvent, the test of loss on drying is not sufficient to control it. So you have to keep a test with a validated method anyway. Okay, we have to consider all the solvents that have been used, also potential contaminants like benzene and volatile reagent and byproduct of reaction sometimes. Let's see for this example of venlafaxine. So there are 6 solvents that have been identified. You can put them where they are used, in which step, and the class that they are, and the level that they have been found in, and the LOD of the method. So for the first 3 solvents, isopropanol, methanol, and formic acid, we can see that they are found not detected, so it's below 10% of the ICH limit, so no control in the API is required. So for toluene, that is a class 2 solvent, it's present at between 7 and 93 ppm, which is above the 10% of the ICH limits. Therefore, control in the API using a validated method has to be implemented. and the specification should be set in line with ICH Q3C, which is not more than 890 ppm. Let's see for ethanol that is used in the last step. So you have to set a control because there is no test for loss on drying in the monograph of vanilla vaccine. So control is in the API using a validated method has to be implemented, and the specification in line with ICH Q3C has to be set to not more than 5,000. Let's see for benzene now, which is a class 1 solvent. The limit is 2 ppm. It's found not detected. The LOD of the method is sensitive enough, so it's below 30% of the ICH limit. So no control in the API is required. So let's see how the specification will look like. So of course, the outcome of the discussion should be provided in section 32S 32, sorry, and the specification should be provided in 32S 41. And which will include toluene and ethanol. And if other solvents are included in 32S41, this will be transparent on the SEP, and the method used to detect them will be appended to the SEP. And this for elemental impurities, which are, no, yeah. Let's move on. So the ICH Q3D guideline is a key reference which cover 24 elements classified as class 1, class 2A, 2B, and 3, and gives permitted daily exposure according to the route of administration. And the internal document from EDQM PAPH CP 1623-2R, which sets a risk assessment requirement to control the elemental impurities and the component approach as per ICH Q3D. So the control strategy should focus on presence or absence of elemental impurity in the API. For presence in API for an elemental impurity intentionally added, a justified specification should be applied, and analytical method should be described in 32S42. Validation should be in line with ICH Q2R2. Absence in the API of intentionally added elemental impurity, which means that you have shown that you are able to purge those impurities below 30% of the defined limit. The defined limit is defined with the route of administration chosen for the API, and also the option from ICH Q3D, either option 1, which is an API daily intake of not more than 10 grams, or option 2A when justified, and a description of the analytical method identified, either ICP-MS, ICP-OS. At least the sensitivity should be provided, LOD or LOQ. So if elemental impurities are introduced in the last step, then specification limit in the API is usually expected. Next slide. So there are two approaches that are followed by in the SEP procedure. So you can provide a risk management summary for elemental impurities. And for this, besides the intentionally added element, which are usually mandatory to be included, you should cover also all the potential elemental impurities that are coming from other sources that you can see on the side of the slide. The risk management summary report should detail the rationale of the study, why impurity have been considered, justify the chosen control strategy, and the intended route of administration. And this will be complemented with a RMS table intended to be appended to the SEP. So batch training data do not replace a risk management summary. Next slide. So this option is encouraged by EDQM because it will facilitate the risk assessment for medicinal product. Okay, for the RMS approach, you have to, if intentionally added elements, if elements are intentionally added, all the elements have to be considered. If they are not intentionally added, then you have to consider the route of administration, oral and topical, only the class 1 and 2A can be considered. For parenteral inhalation, you have also to include some class 3 elemental impurities. And when multiple routes of administration are possible for an API, the worst case scenario has to be considered. Next slide, please. So if you do not provide any risk management summary, any elemental impurity after the introduction of the starting material should be declared and will be reported on the SEP. If you introduce in the last step, a control in the specification of the API should be included unless otherwise justified. And if control in the final API is performed, then a validation of the method according to ICH Q2R2 should be provided, and the method will be appended to the SEP. If no elemental impurities is intentionally added, then this will be also reported on the SEP. In any case, if in both scenarios, if you want to include in the specification control of one elemental impurity, this can be acceptable, and this will be mentioned on the SEP. Next slide, please. So in our case, palladium is used, and it's a catalyst. So, and it has been considered also presence of chromium and molybdenum that can be considered as coming from the equipment used. So screening data have been performed by ICP-MS, showing that those elements are absent, using an option 1 for with oral administration for venlafaxine. So the route of administration should be reported on the RMS table. Then you have to indicate if elements are considered or not. Then you have to indicate if they are intentionally introduced or not. And then you have also to provide a conclusion on the absence or if there is a control for those elements. If the term absent is used, then its definition should be reported below the table with the option that has been chosen. So the RMS table will be appended to the SEP as we have said before. And if you apply skip testing, it's possible, and it has to be justified in line with ICH Q3D. So last class of impurities, reagent and inorganic impurities. So for this, carryover of reagent, in particular toxic reagent to the final substance, should be discussed as applicable. For example, tetrabutylammonium bromide. Absence of carryover in the API is demonstrated using a validated method against a limit justified based on toxicological data or routine control to be implemented at a suitable intermediate or in the final substance. Next slide. So in our case, we have several reagents that have been used and have been considered. Next slide. So for all the elements that have been tested are found not detected in the API. Inorganic residue can be controlled and tested using the test for sulfated ash of the monograph. In that case, there is no need to have further discussion, but anyway, the discussion should be included in section 32S32 under inorganic reagent impurities. So let's finalize this presentation with the take-home messages. So you should show a knowledge and understanding of your specific process and resulting impurity profile. You have to show that you have identified the risk for the quality of your active substance that you are manufacturing, and that you have to show also that your control strategy is able to mitigate the risk you have identified for the quality of your active substance. Thank you for your attention. And now we will move to the question and answer. Okay.
So I will start with a question. So it is stated that a specific discussion on potential mutagenic impurities should be provided. can it be considered that impurity listed in the transparency statement of a monograph for a specific substance are excluded from this assessment as a control limit has already been established in the monograph? Usually, when it comes to mutagenic impurities, the limit which is included in the transparency list of the monograph is already much lower than ICH Q3A threshold. So normally, it is already the case. The limit is already suitable to control the impurity which is mutagenic. And then so do ICH industry guideline Q3A and Q3B apply to nitrosamine impurities in drugs indicated for the treatment of cancer? Not for nitrosamines. It is the case for mutagenic impurities. However, drugs indicated for treatment of cancer are under the scope of the EMA question and answer for nitrosamine impurities. So you cannot apply ICH, Q3A, or Q3B thresholds. So maybe, Gael, you can follow up on a question
Yes.
in the meantime.
Yes, sorry, I will take one. Sorry. Sorry.
Yeah, no, otherwise I just got one. So for products which are administered once every 6 months for a lifetime, which acceptable intake can be considered when calculating the limit for mutagenic impurities? So you have a table in ICH M7 which states which is the acceptable intake to be applied, depending on the route of administration. Then if you have on the time of treatment duration, then it's always the worst case scenario which is expected to be applied. So for example, if your substance can be used for a lifetime, then we would expect to apply the acceptable intake of 1.5 micrograms per day.
Okay, so I have one question. As a general approach, what limit is expected recommended by EDQM for unspecified impurity in starting materials and intermediates? So this is a case-by-case study, because the control strategy is really defining what is the expected limit that you can have for the unspecified impurities. For impurity having 3 intermediate stage, can we apply in-house method for first 2 intermediate stage and last intermediate stage method similar to the final API? Yes, of course. In fact, you usually cannot use the the method of the API during the whole manufacturing process that you are using. So you can, of course, use different methods. The best is, of course, to use in the last step and the same method as the one used for the API.
So maybe I can take another question. So can we adopt the option 4 control strategy for the mutagenic impurities which are originated in the final stage of the API? So normally we would expect option 1. However, you can refer to the question and answer document, which provides some clarity regarding the implementation of option 4, because this will also highly depend on which impurity we are talking about. So for instance, if it has, like, you can justify the option 4 for an impurity which is formulate, depending on its characteristics. So for example, very low boiling points or such characteristics. And there is a specific question regarding this in the question and answer.
Okay, I have one also. In case the maximum daily dose is increased by one of our customers, should we submit a variation? So in fact, this will have to be evaluated if there is an impact of the control strategy or not. If there is no impact, then no variation. But if there is an impact, of course, a variation should be made. How to demonstrate biological safety of the impurity in API. So for this, there are two options. Usually, either you can demonstrate that other products that are already commercial have the same impurity at or above the level that is found in your API, or you have to conduct some testing, animal testing usually, to qualify the impurity at the limit that has been found in your API.
So then another question. If mutagenic assessment is outsourced, is it necessary to attach or refer to the report received from them? Or is it enough to include the table with the outcome of impurity classification and control in section 3S32? We would expect you to provide the report along with the outcome of the in silico assessments.
Okay. How to define total impurity limit in the starting material or intermediate and drug substance specification. So for this, you have to consider the specified, unspecified impurities, and the total should be in line with what can be expected. So there is no real answer to this question. It's we can expect something that is in line with what is the control strategy also that is applied.
So regarding nitrosamine, if any nitrosamine impurity is found negative by structure activity relationships predictions, that can it be controlled as per ICH Q3A? No, because the QSAR will predict the outcome of a bacterial mutagenicity assay regarding the mutagenicity. However, as I said, for nitrosamines, it's the approach should be stricter. So you should really rely on the question and answer, which is specific for the control of nitrosamines. And then you might find, depending on the impurity, you might find some impurities which were found to be negative to mutagenicity in vivo, which could then be controlled as per ICHQ3A. But those nitrosamine impurities are clearly identified in the Appendix 1.
Okay. Can unknown impurities at process intermediate level be specified using the relative retention time, and if the found level is above 0.15? There is no, yes, it can be specified with the relative retention time, and can be found also above 0.15%. So the thing is that you have to ensure that this impurity is not carried over, maybe up to the final API, or at higher level than the one that will be that is acceptable.
So for mutagenic impurities, when can any impurity be considered for skip testing? So skip testing can be proposed only in case you have an option 1 control in place, which means when you have a control directly set in the specification of your final substance. And if you want to implement skip testing, then ICHM7 guideline explains it. You should demonstrate that the level of this impurity is constantly found below 30% of the limit.
Now, there are several questions related to the maximum daily dose. So the maximum daily dose, as defined in the policy document on the content of the dossier. In fact, the information can be found using the database Martindale, for example, or in the SMPC or in the EMA document, the EMA website, sorry, EMA website. So this can be found in this these two options to find this.
Can we consider ICH Q3A, Q3B limits if the AMOS test study is negative for nitrosamine impurity? To consider nitrosamine impurity to be in line with ICH Q3A threshold, it is in vivo study which have to be performed. So not the AMOS test. And again, you should rely on the appendixes of ICH of the EMA question and answer. So either you have it included in the appendix 1, wherein you can see sometimes if an AMOS test has been performed or not. Or if you don't have it included in this appendix, then you should follow the CPCA approach.
So there is one question which is sorry, why benzene is not controlled in final API provided that ethanol is used in the final API? So it has been demonstrated that it's below 30% of ICH limit using a validated method. Therefore, there is no need to have a control in the final API.
So coming back to mutagenic impurities, for option 3, if it is demonstrated that the impurity is found below 30% in a typical batch, does it still need to be controlled in the final API on a skip test basis? To clarify, option 3 is when you control the impurity before the end of your process. So it can be in another relevant material. So if you're proposing option 3, that's different from a control in the final substance, which refers to option 1. So these are two different approaches. So if you justify your option 3 well, then there is no need to further test it in the API. And please pay attention to clearly indicate to which option you are referring to for each impurities.
So for if the elemental impurity is not listed in ICH Q3D, which limit we should adopt to define the control strategy? In theory, as it is out of ICH Q3D, it's considered that there is low toxicity, so it will not be considered.
Is it acceptable to use theoretical purge factors to demonstrate absence of impurities instead of analytical data? This will depend which is the option control that you're choosing. So the purge factors may be sufficient to support the option 4. However, you may need to provide additional data if the impurity is formed late in the process. Otherwise, analytical data would be expected for other options.
So, is residual solvent test mandatory to be included in the final API specification? For this, if you are not using solvents except than water, for example, you may not need to have a test for residual solvent if you have demonstrated that they are below 10% of the ICH limit in the API. What is the acceptable limit of RRT impurities in KSM intermediate and API? For this, I think that it depends on the control strategy that you have applied.
So if any impurity is less than the reporting threshold, should we consider it for mutagenic assessment? Yes, because the assessment for mutagenic impurities should include all the impurities and not only those which are found in your substance, but also all other impurities, because it's different thresholds that apply. So, for instance, the reporting threshold, if we consider a substance which is administered for less than 2 grams, the reporting threshold would be, for example, 0.05%, whereas this may be much higher than the TTC limit, for example. So all potential and actual impurities should be considered.
If a substance listed in ICH Q3C is not used in the manufacturing process but may appear during the manufacturing reaction, should this potential substance be controlled as a residual solvent? Yes, if, for example, there is a generation of acetone during the, I don't know, hydrolysis of acetonide, and then you have to control this solvent in as a potential solvent in the process. It's a side product or byproduct, but has to be controlled anyway.
Then I have a question. So if the pharmacopoeial impurity is not possible in our active substance manufacturing process, is it necessary to include it in the API specification, or justification for its absence can be provided? If you explain and justify that the impurity is not possible, then you don't need to include it in your API specification. However, you should provide the justification in a relevant section, so it can be under impurity section or under the section from 3 to S4.
If class 2 and class 3 solvents are used in the process, can we use LOD to control class 3 solvents and use a specific method to control class 2 solvents? Yes, of course. Or should they all be controlled by a specific method? No, you can control by the LOD and the specific method for the class 3 solvents.
Then for nitrosamine drug-related nitrosamine impurities, if the specification exceeds 1 ppm, is it necessary to establish the LOQ at 10% of the specification, or is a lower limit of quantification required? If you want to prove that the omission of a control is justified, then you will have to set to have the LOQ at or below the specification limit. Then if you intend to implement a control in the specification of the final substance, then the requirement is slightly different because you need the LOQ to be suitable in regards to the limit. So a limit of quantification higher than 10% would be acceptable if you're implementing a control.
Okay, an elemental impurity which is not intentionally added in the process, but it's found in some API batches at level above 30% of the limit. In the majority of the batch, it is found well below 30% of the limit. It is within limit in all the batches. Manufacturer decide to keep the test for the impurity in the API proactively to avoid any random occurrence of the impurity at higher level. Should you expect the dossier for what discussion would you expect in the dossier for the discussion? So this has to be, this is a specific case, so it can be implemented as a control. There is, this is based on, you can develop, in fact, the argument that is found randomly in the process, and the control will have to be set in the final API accordingly.
So in case of a short route of synthesis, nitrosamine drug substance-related impurities need to be controlled routinely, even if it is not detected. So again, to omit a control of a nitrosamine in your final substance in case you've identified a risk, you need to demonstrate that the levels are found below 10% of the limit. Then I can see several questions regarding ICHQ3A thresholds, which could be applied or not for mutagenic impurities. So from the perspective of the certification, we do expect TTC limit to be applied for class 2 and class 3 impurities. And then also specific limits for class 1. However, if you go beyond the TTC approach and if you're proposing another limit, then this will be assessed by a toxicological assessor. So can the analytical method use at release of the active substance for testing a nitrosamine impurity validated as a limit test instead of quantification method? So can the analytical method use at release of the API for testing of a nitrosamine be validated as limit test? I think the question and answer document foresees the acceptability of valid test to control nitrosamine impurities. Then you just need to check, like, of course, the limit test outcome should be coherent with the limit.
So during routing tests for residual solvent, no peak is observed. Should the result be written as not detected or less than detection limit? For this, you can put the not detected.
So then for other questions, you can also use our help desk if your question has not been answered during this presentation.
Yeah, thank you for both of you for your presentation and your answers to the questions. And as said, do not hesitate to send us your questions to our help desk. And also you will receive the presentation and the recording in the next few days, and a short feedback survey will appear when you exit this webinar. So thank you all and have a nice rest of the day. Bye-bye.
Thank you. Bye-bye.
Thank you.